mute yourself. Hi, everybody. Welcome, welcome. Come on in, come on in. Seeing people starting to populate and make their way in. Nice to have you. Get yourself situated. We're going to get started here in just one more minute. We'll give people a chance to grab their sandwiches and drinks and get themselves settled. If you're just joining, nice to have you. If you've shown up today and have a question all ready to go, please feel free to drop it into the Q&A. We will be integrating questions throughout the session, and any questions that we aren't able to integrate, we will make sure to try and pick them up at the end. This is such a hot topic that we expect there might be more questions than we're able to answer today, but we are going to do our best. We're going to get started here in just another 30 seconds or so. And just a reminder, if you're just now joining, first welcome, get yourself comfortable. We've got a great session here for you today. If you have questions, please use the Q&A box down there, and you can send us questions directly, and we will attempt to get through any questions that you have throughout today's session. We're going to launch right in. My name is Nick Merriam, and I am the CEO of sea.citi. We are a tech industry nonprofit, and we are really focused on working with tech and tech workers to get informed about what's going on here in our local community, as well as providing you meaningful ways to engage. We love tech. We love to see tech active in the community, and we so appreciate you showing up today for this fantastic talk. Today we have Patty Hayes talking to us during our Roadmap to Recovery series. She is the director of Seattle and King County's Public Health Department. Patty has over 30 years of experience in public health, policy development, and advocacy. Most recently, she has been responsible for the COVID-19 response for King County. In addition, King County Executive Dow Constantine and Patty declared racism as a public health crisis. Patty is co-leading the efforts in the county to address systemic and institutionally racist policies and procedures and build pathways for community-led solutions. Patty has received numerous honors and recognition. This is actually a pared down bio, so she's very impressive. She's one of the recognitions that we have listed is including the University of Washington Alumnus Summa Laude Dignitatis Award in 2020. Patty has a bachelor and a master's in nursing from the University of Washington School of Nursing and was inducted into the Washington Nursing Hall of Fame in 2002. Who knew that there was a Nursing Hall of Fame? But you're there. That's fantastic. So I'd like to welcome Patty, and Patty, maybe you can just start by giving us a little bit of color on the role of our local health department.
Sure, thanks, Nick, and it's so great to be with all of you. And as we're learning in this virtual world how to be together, so thank you first for sponsoring this, and your organization is tremendous. The role of tech here in the Seattle King County area is undeniable, right? And it's great to do this. So your health department is a critical part of local government across the country. In the state of Washington, we're a home rule state, it's called. So your health department at the county level is really the seat for where public health action and decision making and the rubber hits the road for how we are working to both protect the public from things like communicable diseases, but also how we promote health and look at how our community is faring in terms of health and health issues. So we do everything from overseeing restaurants. There are 12,000 restaurants in King County, and we actually regulate them. We have teams that do restaurant inspections, and I'm sure you've seen the rating system out there. I actually sign the bottom of every single one of those. Actually not, but anyway, you can see those. We have a very creative emoji system that was actually developed in concert with community as to how could we show how well restaurants are doing in multiple inspections and in how they're protecting your health as they are delivering great service to us. Public health also oversees things that deal with direct service. So we actually have a clinic system that's kind of like thinking about the backup to the safety net. We have great services here, but there are certain populations and certain parts, particularly in the maternal child health world. We do all the maternity support services here in the county and in partnership with a couple of community-based services. So we have a set of clinics. We oversee all the school-based health centers that are so important to our youth. We also are your data hub, and if you go on our website, you can see our various dashboards and the work we're doing with communities to look at how is Burien doing in certain things versus how Seattle's doing versus how up in Lake City. We're working with those communities on the data that is everything from smoking to healthy habits to the role that unemployment plays in health. So you've probably heard about the social determinants of health, and that's something public health pays a lot of attention to. We want to look at those things in each of our lives that actually affect our health. So we know, for example, if you're under a lot of stress, if you're unemployed, if you have trouble with stability in housing, those things actually have a direct impact on your health. The more stress we're under, look at it this way, your adrenaline changes, the amount of things that is able to cope with is all challenged, and those actually have effects on your circulatory system, on how well you fare as you grow older. So public health watches all of that, and the data, we have a marvelous data team. In addition, we have just one of the flagship epidemiology teams in the country. CDC often uses us as an example of great work for disease investigators. The work you see on TV is not really how disease investigation works, but we have those disease investigators here, and a lot of them are nurses who work with community. They work with you if you come down with a communicable disease, whether or not it's COVID or some other communicable diseases that we have here present. And we help chase down who the contacts are, make sure you know how to keep yourself safe, offer you services if you need help, if you need to be quarantined or isolated. So the wide range of public health work is both prevention as well as helping folks who are needing services. Our teams are highly skilled, and yet we're often in the background. You often don't see us front and center like you do the hospital personnel or whatever, but we are the group that pulls the glue together for the health of the community. So why don't I
Well,
stop there, Nick? I could go on for an hour, you know.
yeah, yeah. Well, let me first just say thank you so much for your public service here, especially in these scary times of COVID. I kind of want to just dive right in, and can you just talk to us a little bit about where are we with COVID? I know a lot of the national news is reporting significant upticks. I mean, we recently crossed 200,000 deaths nationally. We're seeing high case numbers reported. I think last Friday might have been the highest number reported in the U.S. so far at like 60,000. I think I'm getting that number right. Where's King County? Where are we doing? Like, what are we doing? How are we doing?
So I have a slide, but let me, before I jump to the slide, just to kind of level set for everybody, what's a pandemic? Just real quickly. And why is that unique? Because in the very beginning, there was a lot of conversation going on, and there's still nationally some rhetoric around how's this different than things like the flu. What's very different? And there's three reasons. So you can think about it this way. Number one, a pandemic has what's called a novel virus. What does that mean? It means that we do not have experience with this virus. So coronavirus is part of a family that's coronavirus, but it is unique. And so what it means is you do not have natural immunity to it. That doesn't mean that different people aren't impacted differently, but when you have a virus that we have no experience with, it creates a whole new spectrum that leads to what you're talking about. Higher level of infections, more risk to people. We learn real time about it. You are living, and you guys, if anybody, would really appreciate this. This is science in action here, folks. What you're seeing is we are learning about this virus as we're going, and the guidance changes when the science develops. Duh. So people get all upset that the guidance changed. Well, that's because the science is changing. So we should really embrace that. The second thing is there's no treatment known for it. Now, there's been a lot of work over the last 7 months to try and get some ideas on treatment. For example, in the very beginning, we put everybody on ventilators when they were in the hospital, when they had respiratory distress. Now doctors know that you can put folks on their stomach and delay putting people on a ventilator, which is a really good strategy because there's a lot of bad outcomes that can happen just from having to have a ventilator. It's very traumatic. So the third thing is there's no vaccine. And we know we're going to talk about that, Nick, a little bit later, but those are the three components. So with that in mind, let me show you the metrics. So if you could put the slide up. So every week we update this key indicators. Now this is actually a kind of condensed version on this, but it matches the governor's indicators. What this is on the website, and at the bottom right corner you can see the link there. You guys would love going in and looking at all this data. So I will gift that to you today as a place where you can go and look at all the relevant information. This is just one of our dashboards, and we put it up every week. You'll see that we're not meeting a lot of these metrics. There's a couple that we are. What you'll see is that these are the key elements we're watching on an ongoing basis that Dr. Duchin, our health officer, and I look to. So the first thing is, what are the trends in the numbers? You'll see that we're targeting 25 cases per 100,000. That's really a manageable pandemic, if there is anything called a manageable pandemic. But the lower the numbers are, the more we can case and contact trace, the more we can keep this manageable to reduce the number of deaths, to make sure the hospitals don't get overloaded, all the other things. You'll see right here we're at 53. I expect that number actually to go up because in the last 7 days we're seeing a higher uptick from a number of reasons. We're having more outbreaks. The fall brings people indoors. That's higher risk. We've got the University of Washington back in session, and we're having more employers open up, which causes workplace outbreaks. So the second one is it growing or is it shrinking or is it stable? So this is, you've heard it called the R naught or the rate, the reproductive rate. What this means is how many people get infected at a time when somebody comes up with coronavirus. So we're trying to keep that number below 1. It was below 1 for almost an entire month, and then in the past week it bumped to over 1 again as our numbers are going up. The next one is we're looking at hospitalizations. We've been fantastic in this region. We are lucky to live in this region for 2 reasons. Number one, our hospitals all work together. That doesn't always happen around the country. And secondly, they early on made a commitment to maintain a capacity so that if we did have a huge swell of COVID cases, that they could manage it and that we wouldn't have what happened in Florida, in Texas, in California, in Arizona, in New York. And indeed, we've had really great fortune so far. I have to knock on wood for that, Nick, but so far it's been really good. And then we look at testing capacity. So we always want to have more and more testing out there, but we're really having trouble for a number of reasons keeping our testing capacity up. Number one, I think that folks don't always realize they need to go out and be tested. So you need to get tested if you're exposed to COVID or if you have symptoms. We want you to do that. We need healthcare providers to refer people for testing or to refer them to our drive-through sites. We need this testing because when we identify these cases, it allows my team, and we, as you see here, we have over 60 contact tracers that are working every day on every new case we get to find out where did it come from, who else do we need to make sure we're testing, who else do we need to isolate or quarantine. And then we're always working to look at the community well-being and mental health. This pandemic has so many implications for the health and well-being of the population. We watch that. So those are basically where we're at right now, Nick. We're seeing an uptick that's nerve-wracking. We know the fall's coming, that flu season can affect it, but our hospital's in good shape and we're working to increase testing.
Well, and I think my next question for you is really around, I mean, you guys are doing such a great job of being data-driven, and that's something that we talk about all the time in tech, is making sure that we're making data-driven decisions. I mean, it's sort of classic what tech is known for. Can you just give us a little bit of insight around data collection and aggregation? Sort of what are the models that you're drawing on, and sort of how do you evaluate like the quality of the model that you're pulling into making these policy decisions?
Yeah, that's such a great question. So first of all, we're really lucky in Washington State that particularly King County as a metro, we're by population served, King County Public Health is the 9th largest health department in the country. So our data systems that we have set up here with the support of the state and the federal government, we actually do a lot of our own analysis. So we collect data from all sorts of sources, from laboratories, from state systems, from the federal government surveys that are done, from there's a school survey that we help get data from. So our data team pulls all of these different data resources together. So particularly in the COVID world for this pandemic, there are core data systems from the state where laboratories have to report positive and negative cases directly into the state system. So that helps us pull that data. We pull that data at least daily, if not twice a day, so that then we run it through our systems that get it down to as close to the zip code level as we can, because we're watching it. Then when we have outbreak identification, there's a data system that our contact tracers put in that then tracks everything so that we know race, ethnicity, we understand where the workplace was. When we do an interview and folks say, well, I went to this restaurant and oh, I did have a backyard barbecue and had 25 people there. I know I wasn't supposed to do that. I did that. Oh, I went to my church and we had a wedding, blah, blah, blah. Then we put the picture together over vulnerability. Then we use the Institute of Disease metrics for the reproductive number work. They are working nationally with that. In terms of the modeling, Dr. Duchin, our health officer, is one of the leading communicable disease specialists in the country. So he's plugged in to CDC and to the national modeling. So he really knows kind of the assumptions of these different models. He actually advises a number of these national modelers on the assumptions they're making and how that works or doesn't work for King County. So we pull all that together, it creates our dashboard. We have a dashboard that's literally looking at the economic impact of the pandemic, as well as particularly a dashboard on race ethnicity, since COVID has shown just a huge light on the racial inequalities that have been present in healthcare and other places for a really long time, but it's just accentuated by COVID.
Yeah, and that's a really great tee up for the next question around racism in public health. And just King County announced recently that racism was a public health crisis, and how specifically is that shaping the response, sort of the actions that you guys are taking, and the way that you think about the pandemic right now?
Well, you know, what was a very important time that COVID came on the scene, and then with the death of George Floyd and Breonna Taylor and these other emerging things where we came to a moment in this country that was really important to me because public health has always seen these racial inequities and the downstream effects from things like redlining and economic opportunities and just so many places that it was really important for me in making this declaration with the executive that it wasn't just a declaration, that we had a plan to do something, and we are one county where we are blessed with elected officials that are intent on doing something. So both the mayor in her work and the mayor of Seattle and County Executive Constantine in particular has focused his whole budget on developing the first, I think, move to an anti-racist budget that not only is realigning services, but is intent to create systems so that the community table helps define and move where we're going in government. Um, I've been working since being at King County to identify racist policies within the public health system or our human resource system, for example, so that we can change so that we are bringing community-driven solutions to the table. So I'm really proud to work with the county executive and to have helped him last 2 weeks ago announce his budget, particularly in this area where we are really taking dramatic steps to change the way government's doing business and really raising up community voices.
I think that's such a powerful piece of language, an anti-racist budget. I mean, I think that just really, really strikes a chord. You know, with these events, we spend a lot of time trying to surface both how tech and public partners are really taking a hard look at racist policies and what we're doing to change them. And on our end, we're very committed to having open dialogue and open conversation about those issues. So
Terrific.
super happy that we can spotlight some of the work that you're doing. I want to shift a little bit. You know, a number of the folks on this call are gainfully employed, you know, possibly have children at home. Like me, I'm working from my basement. I can hear my children run across my ceiling as they run around upstairs. That has definitely placed a fairly significant sort of mental health piece into the workers that are continuing to work. And in some cases, some of us are working harder than we were working before. Can you just talk to us a little bit about mental health and managing mental health during these times? What should we be doing? What should we be looking at?
Yeah, this is such an important thing. Thank you for making the space to talk just for a few minutes about it. You know, a pandemic, this is going to impact us for a generation. And I think that's something for we all need to give ourselves gracious space about. Being isolated at home, having to do so much change, the disruption to families, the impact on young children, asking a 5, a 6, a 7-year-old to do remote learning. I mean, let's get real. That is pretty much impossible. I mean, we're managing right now, but all these things affect each and every one of us. I would gift to you these couple of things. I think first of all, you have to find a moment to be able to distract yourself, and that's unique to each of us. Some of us do massive amounts of exercise, and we have to reinvent how that's happening. I think the Peloton business is busting right now with home equipment. Um, other folks use different strategies. So you have to find that space. How do you break away? Because it's too easy to sit. I do it myself and just go for so long in front of our systems here, never take a break and move around. That's not healthy for your body, but for your mind, it's not. Secondly, how do you find that space? I'll call it that equanimity space. And that's different for each of us as well. I myself, I am a student of cosmology. This is going to sound nuts, Nick, but it's the truth. I love the universe. And one of the things that distract me is I read about different things about the universe, the expansion of the universe, dark energy, all of that. It helps me in my perspective of things. So that's part of this piece of equanimity, to find that. And then thirdly, you've got to set up your boundaries. You need to get the right amount of sleep. Lots of sleep disorders right now. We need to watch what we eat. Excuse me, let me get a drink of water here. And then find a way to participate with your your network and your community like you're doing here.
Yeah, well,
So let
thank
me
you for
stop
the
there while I'm coughing and you ask me the next question.
Yeah, well, thank you. I definitely have implemented some of those things myself. Personally, I carve out 5 p.m. to 8 p.m., which is family time, and there's no interruptions ever. Phone goes somewhere else, and really try and do my best to make sure that that time is sacred. Although I probably could use a little more exercise these days. I want to, we're getting so low on time, and this always goes by so fast, but I really want to ask you about vaccines, and I'm going to ask you to answer in like less than 2 minutes. Timing of a vaccine, realistic distribution, like what's real?
Yeah. So happy to do that really quickly. So we're on track and being asked by the federal government to develop our vaccine distribution plan right now. I think we will see something by the end of the year. You can expect that first responders will be the priority group to get any first vaccine. So that'll be your healthcare workers, our great folks in emergency medical services and the fire department, the police. And then there'll be a tiering of folks to get it, so that Dr. Anthony Fauci on the national level has predicted that the general population will probably be getting the vaccine by middle of next year. And then it's going to take a while to get through. There is a new survey showing people are hesitant. So I think some people are not going to be super anxious. We want to deal with how to roll this out and to really show that it's been tested and it's safe. We're committed to that. So watch for that over the next year. But the good news is it's coming. The bad news is it's going to take a year to distribute it.
Yeah. Okay. One quick question from the audience. Somebody asked what the bar for someone, what's the bar for someone being tested? They have small kids, so sniffles happens. They don't know anyone, but and that's had COVID. But like, how do you decide whether or not you should be tested? And as a quick side note, I've actually taken the scan test before, the home thing, which was brilliant. It was an amazing delivery system. I was so impressed by it.
Yeah, SCAN is a great partner, learning a lot from it, and it's developing new technologies. So the bottom line with testing is that if you have been somewhere where you could have been exposed to COVID and you find out that somebody actually had it, you need to get a test. If you have symptoms and you're worried that you could have been exposed, you should get a test. If you have a child that has sniffles and has been in a daycare, that we give advice to daycares on that with kids. You need to keep folks home. There are colds going around, so you need to keep yourself home if you're sick, so that you can really get over that and not be out spreading around other things. And of course, you want to wear your mask and you want to just protect yourself. So those are the bottom lines with when you go and get a test. And there are certain places that require you to get a test to go to. I had family down from Alaska. Alaska won't let you back in Alaska if you don't get a test. And Hawaii's been doing that as well. So you may be traveling somewhere where they're going to require it.
Yeah. Okay. Thank you. So final question for anybody that wants to get engaged in public health. We know that you've got a couple of initiatives going that they might be able to participate in. Can you tell us quickly about what people can do to be supportive in the community?
Yeah, one of the things that you can do is I have a community ambassador program every 2 weeks, and one will be this week. We send out a blast email so that you can get your networks the latest news, and I try and make the messages we're sending out kind of, I'll call it, we freshen it up, we jazz it up every couple of weeks with a new theme so that we can help the community own these strategies that we do: wearing a mask, physically distancing ourselves, washing our hands frequently, staying home if we're not well, protecting our neighbor, checking in on people. So you can, in the chat, I know there was my email in there. You can sign up through that. You can tag me on Twitter. Yeah, I saw my Twitter address was in the chat box too. And then thirdly, we have the Public Health Reserve Corps. And if anybody is interested in really volunteering, you can sign up and apply to be a Public Health Reserve Corps member. We call on these people. We have them, folks at our testing sites, kind of just getting the traffic in the right order. Lots of nurses vote for that. So there's a range of things to do. So just some ideas, Nick.
Great. Thank you so much, Patty. It's been such a pleasure having you here. We really appreciate you taking time to come out and talk to our group. For those of you still here, please be aware that we will be sending out a curated list of information that includes things that you can do to take care of your mental health, as well as some of the resources that Patty mentioned today. If you've enjoyed today's event, please feel free to come back in 2 weeks, where we will be talking about digital equity with the City of Seattle. Patty, thank you so much. I hope you have a wonderful afternoon.
Thank you.
Great to see you. Take care.
Great to see you. Thanks so much.
Bye.